TopMedTalk.
Well, hello and welcome to TopMedTalk. We are coming to you live from the Windy City, Chicago, Illinois, for the annual meeting of the American Association of Nurse Anesthetists. I'm Desiree Chappell, your host. Normally I'm joined by my co-host Monty Mythen and Saul Aronson, but unfortunately they couldn't make it this trip. Miss you guys. But this does mean I'm flying solo, but no worries. We have a surprise guest host that's going to be joining me over the next couple of days, so stay tuned for that. Now, I'm also here representing NorthStar Anesthesia as the Vice President of Clinical Quality for NorthStar, and we want to thank them for supporting TopMedTalk to be here at the meeting. We are here in the exhibit hall at the annual meeting on the NorthStar booth, so again, thank you to NorthStar for supporting us. Now, it is day one of the meeting here in the exhibit hall at the AANA. Now, if you don't know or not familiar with the AANA, it is the professional organization of Certified Registered Nurse Anesthetists here in the U.S. And I myself am a CRNA and excited to be here. This is the third year that TopMedTalk has been able to have amazing conversations with fantastic CRNA representatives from around the country. Now, I want to get right into our conversation and introduce our next guest. We have Joe Rodriguez, who is a CRNA and managing partner for the Arizona Anesthesia Solutions. Joe, thank you so much for joining us.
Thanks for having me. I'm excited to be on.
Yeah, absolutely. Did I get that right?
Correct.
Sure.
Yes. You know what I try to do is add on every single title I've ever had for these introductions.
Joe, we only have 20 minutes.
Honestly, it'd be pretty short. But no, you got it right. Managing partner for Arizona Anesthesia Solutions. It's a multi-city group based in Phoenix, Arizona. And we have 3 managing partners and obviously a number of senior leadership members outside of that. That's my day job. And also, I serve on the board here at the AANA.
Yeah, I was going to ask you about your board position. Congratulations.
Yes. Thank you. Thank you. Lots of fun.
Yeah, tell us a little bit more.
You know, the role of there's 2 parts, right? The first role for the association itself is to try to maximize the value of CRNA services across the country, right? And that takes place in a number of different roles, regulatory, but also on the reimbursement end. And it's important to emphasize that the role of the association is to increase value for CRNAs, but not at the cost necessarily of anyone else, right? So that's part one. I think the role of the board member, it's evolving, right? And just a few years ago, there was only 10 or 20,000 people, and now it's primarily, to put it in really brief terms, it's strategy, fiduciary, and really that's it. Those are the 2 things we really work on. We try to solve problems not on the 1 or 2 or 3 month level, but at the 3 to 5 year level. And that's really it.
Well, Joe, for our listeners, tell us a little bit about some of the strategic goals that you guys are working through right now.
So I think one prominent strategic goal that we are working through is trying to fix payer parity, right? So a lot of folks say, well, hey, wait a second, how are you going to be the cost-effective solution if you're paid the same? Right? And that's when that comment comes up, it indicates that that person really does not have an understanding of anesthesia finances and economics. Because really, in anesthesia, money comes from 3 places, right? It comes from patients, of course, and their copay, right? It comes from the insurance company directly, and it also comes from hospitals. Because increasingly, the vast majority of anesthesia practice is subsidized.
Yeah, for all anesthesia services.
For all anesthesia services, right? Because, you know, the truth is if you compare a CMS case versus a United case, you're looking at about 20% reimbursement level. So you can do 5 total knees for CMS and get paid the exact same you get paid for United Healthcare. Yeah. So that really fragments the finances. And what we're trying to do is say, look, in order to not damage the ability of hospitals to expand their services and keep taking money out of their pocket, what we're trying to do is say, if an anesthetic is delivered in a high-quality way, regardless of the type of professional that's involved, then that case should be reimbursed at the same level. Yeah. And that's that. If there is some sort of subsidy or stipend that goes on outside of that because of the profession and because of the market involved, obviously MDs and CRNAs operate in different markets, then that has to happen as well. And certainly everyone, I'm a big free market advocate, right? Everyone should be advocating for as much as they can get on the open market. And there's certain realities that obviously companies like NorthStar have to deal with, and that plays in as well. But as far as the reimbursement for the case itself, it helps the system, in our view, it helps the system when those cases are reimbursed at the same level.
Yeah, absolutely. Well, that's great to know that as an organization that is a priority.
It's a major problem. I mean, you have states like Medicaid who don't reimburse for CRNA services, and that means all those low-payer patients, they have to go to higher-cost centers.
Yeah.
It's like it's one of the worst things ever.
Yeah.
And it's
we
a
have a lot
problem.
of conversation. It is a very complex problem. We have a lot of conversation about healthcare economics in general. On
indeed.
TopMedTalk, and this is just one of the many challenges and complexities that we're having to work through right now in the American healthcare system, for sure.
Indeed.
I can tell you that this is happening, all over the world in the conversations that
and single payer systems. I mean, they present their own challenges.
They do.
So we're looking at some of that here, and then overseas they're looking at some more market-based reforms.
Yeah.
There's no perfect solution. We just got to try to find the best solutions for now.
So, Joe, you're kind of known in our space for a healthcare, one of the leaders in the business of healthcare and the business of anesthesia.
That is very kind of you to say.
Well, you are, and so I kind of wanted to get your perspective as a business owner, or part business owner, and where you feel like CRNAs fit into that space.
Sure.
What are some of the great opportunities that CRNAs have in the business of anesthesia, outside kind of, very typical in the box, kind of idea.
Sure, it's different than running a Wendy's.
Yeah. little bit.
Yeah, indeed.
I don't know. Some people say whenever you have those ambulatory centers with your knees, it's like a Starbucks.
Popping in and out. Sure.
But, from your perspective, what are some of the unique opportunities that CRNAs have as business owners?
Great. So I'm glad you asked this. There's a very unique way that CRNAs can get involved in enterprise or business, and that's because our community, because of all of the advocacy that goes on, is uniquely positioned to make what I call to become dual purpose companies, right? Which is, obviously, Milton Friedman said the business of business is business, right? The business of business is to drive profits. And that's true. You have to be financially viable. But what's also important, in addition to driving on the road of business, is to take some time and help support the road that all of our collective practice actually goes on. And what it does, the fancy word...
infrastructure kind of thing.
Yeah. The fancy word for this is corporate social responsibility.
Yeah.
And when you look at the literature, the business literature of corporate social responsibility, it basically says that when you're in a community and your values are aligned with that community and you do work outside the business, it actually benefits the business. The classic business example here is probably Costco, right? Which is I know we didn't know you were going to be talking about Costco today. But the reason Costco is interesting is because their CEO, Dave Senegal, he paid his employees more, and he was criticized on Wall Street and in the business community because you're paying too much.
Yeah.
And his famous response was, well, it turns out when you pay people well, they spend their money, and I want them to spend their money at Costco.
Yeah.
Right? And that didn't help their bottom line, but immediately, but in the long term, it did help the business. It was better for the community. It was better for the shareholders. It worked out better for everyone. This is commonly referred to as stakeholder theory in business. And I think CRNAs, even though we're, primarily thinking about putting a tube through vocal cords, right, we don't realize that we are uniquely positioned to make that contribution. And that's what we've done in Arizona, and we've been really happy to do it.
Yeah, that's fantastic. I always like to say a rising tide floats all boats.
Indeed.
And I think that's from the world of anesthesia. The specialty of anesthesia. We need to think of that.
Absolutely.
As a whole.
We're all connected, right? In the service-based economy. The surgeon does well, we do well.
Yeah.
If we do well, the hospital does well. We have to consider that. It's not just about us. It's about all the stakeholders that are invested.
Yeah. Well, what are some of the unique challenges that you feel? I know, again, we could go down a rabbit hole.
Yeah.
But at a higher level, some of those things that if someone is interested in getting into business for themselves, whether it's for an anesthesia, contract at a large hospital or an aesthetics service, that a lot of people are getting into now.
If you're employing others or contracting others, that opens up a whole box of challenges, right? But I think, so there's two pieces here. The first is, if you want to get into business, it should not be only or primarily because you just want to make money. If you want to make money, you can make a ton of money on the locums market now, right? If you want to make an impact, right, if you want to have creative control over how your professional life is, then you should get into it. And that for me is very satisfying because I have a set of values, and it's very important for me when I go to bed at night to know that I'm living by those values, including the way I work, right? Yeah. So that's part A. Part B is that obviously we're experiencing once in a lifetime compensation rises because of the extreme shortage. So we are having conversation after conversation, and where there's chaos, there's opportunity. So what we've seen is hospitals do a number of things is to, one, optimize payer mix, which they can only pull that lever so much, right? They're also increasing OR utilization, which helps to some degree as well. But we're also having a conversation around how do we get maximum value out of all the professionals involved, right? Stop the whole pro MD or pro CR. Like, just stop having that conversation. Look at the people involved. Say, how can we maximize their talents? That's how we're going to get through this, right? Yeah. And you pull all those levers, and you might have a chance of success. So I think that's the challenge that we've been trying to meet effectively, and I like to think we're doing okay. But ultimately, for every anesthesia organization, if you're not operating from a position of how do we generate maximum value for facilities, you are weakening your position. That is very unwise. That's bad for all the stakeholders, right?
Yeah. This is, I'm always worried about, in the conversation we're having a ton right now with, many different anesthesia clinicians and providers, is the sustainability.
Yeah, indeed.
Of the workforce, the way it's going right now.
Sure.
I mean, it just doesn't seem like, if you're looking at the business of anesthesia, it's not quite adding up.
Right. It's a hard business to be in right now. I advise going into corporate real estate if you really want to make money.
If that's what's important to you, yeah, for sure. Well, I know we're going to have more conversations over the next couple of days about, about the business of anesthesia and how we kind of make it through as a profession.
Right.
And how we see that. I was curious to know, in your business, what are some of the things that you guys are looking at? I know you kind of said high level.
Sure.
Trying to put people in the right place at the right time to do the right thing. Kind of thing.
To drill that down a little bit further, what it means is going to like we have gone to probably a dozen facilities in the past 6 months and said, hey, your payer mix is at, I'm just going to use round numbers, 70. The cost of doing business for payroll alone is at 80. It eclipses what any reasonable company could generate from your cases. Yeah. That means we have to pull some of those levers, but often it means there's going to be a stipend involved now.
Yeah.
Right? So that's part A. So we've renegotiated on that side of the business. The other side of the business is increasing compensation. Because look, if I'm an individual on the open market right now, I'm feeling really good.
Yeah.
Right? But what I emphasize for them as well, because a lot of people have a false understanding, well, I'd say the vast majority of anesthesia clinicians do not understand the finance and economics and the reimbursement, right?
Yeah.
And so when they say, hey, look, I did 3 total knees, and I say, hey, look at the age of these patients, and look at what you just got compensated. They're like, oh my gosh. And I say, do you want to be fee for service? And they're like, no way. Yeah. And this is a real conversation I've had dozens of times. So while we have changed the compensation, it's also educating them to say, hey, the margin in this business is single digits. We're talking about 2 to 5%. Yeah. So once you're honest with them and transparent and say, this is the reality, it's like, oh,
I think it's actually teaching them.
Indeed,
it's just the education. Again, like you said, this is not something that a lot of people know.
No.
There's a lot of, there are a lot of different voices out there saying, know your worth, know your worth.
Sure, hashtag know your worth. Yeah,
exactly. Yeah. It's know your value in the system as a whole.
Right, and the thing about the know your worth thing, it's like, well, hey, I generated $2,000 because I did all these GI cases, and it's like, well, that's great, but why would that be more than the guy who's doing cardiac anesthesia, right? And as soon as you use, and then another conversation I've had is, well, look, I generated all this value. It's like, well, okay, great. Are you willing to take less pay on the days when it's not as productive? Because if you are, we can have a conversation about that. But if you're not, you can't have it both ways, right? You can't say, well, I'm all about the worth and the value, but then if the cases disappear, no, I still want to be paid, right? Yeah. Someone's got to bear that risk, and if it's the company itself, like our company, for example, we put all the money into a pot and make sure everyone gets paid. Yeah. And that means there's some days that are great, there's some days that are terrible, right? And facilities have asked us to move to a fee-for-service model, and look, there's just no appetite for that.
Yeah, right? I know. Well, one of the things I really wanted to get your perspective, just from your past experiences, what you're doing right now with your own company, and then from the board of directors. We talk a lot about value-based care models and different things, what we see coming down the pike and the future of healthcare in America. What are your thoughts on that, and how is the AANA, and I don't even know the answer to this at all, but how are we addressing, those different models that are coming down the pike in the future?
So it's interesting. We've been talking about value-based care for a long, long time. Right? Yeah. And it's only been implemented to some degree or another. And I think there's always going to be a degree of productivity pay, right? Because if you take all the productivity out, we're human beings and we tend to work on incentive, and that doesn't always work so well, right? But I think at a broad level, moving in the future, I think we're going to see more and more population health management, rather than canceling, 20% of cases, I'm just using a round number, canceling 5% of cases for a variety of different reasons. As much as we can, if we can reduce variability in some of the clinical practices, and then, and this is key, because I enjoy using creativity, right? Then we use people's minds and their judgment and their experience and their insights, and we make sure that they're actually being applied to difficult clinical situations. Right, and that's really the future, to try to standardize care. You know, what's the BMI? The BMI limit doesn't have to change from Wickenburg to Phoenix, right?
Yeah.
The patients are going to be the same, but as far as the data is going to be the same. But how do we make sure that we're using provider judgment in the right way? I think that's a big part of it. I think at the broad level with the AANA, I think what we're trying to do, and again, is make sure that our members have the ability to make, and again, it's so that facilities can make choices in the market. But individual members, if they have the ability, just like any other professional, to make that bigger contribution to patient care, I have a big announcement that healthcare is desperately in need of those services. Overwhelming. Like, I'm using big gestures here in the studio. I cannot emphasize how much the American healthcare system needs that. And ultimately, to be 100% honest, the better this works for our country, the better our country is. That's how we keep our global competitiveness. It all connects, so it's super important.
Yeah.
Not that I have an opinion on the matter.
No.
So
I couldn't tell that you were passionate about that at all, Joe. Well, thank you so much for sitting down and taking time. I know your schedule's super hectic during the meeting.
This is awesome.
Hopefully we can have another opportunity to talk in the future and kind of come back around on some of these topics. Really just, appreciate the leadership that you have for within the AANA for anesthesia in general.
Pleasure.
So,
my pleasure.
Cheers to you. Thank you very much. You can always find us at TopMedTalk.com, on our podcast, TopMedTalk. We're on all your favorite social medias, LinkedIn, Facebook, Twitter. We are there. If there's something that you heard today or any other time you listen to TopMedTalk, please be sure to share that with friends on social media, through text, whatever. Get the word out there. We really do appreciate that. So, Joe, thank you again. Cheers to you.
My pleasure. Thank you, Desiree.